The majority of the private health facilities in this country, about 65% and above, are owned by clinic officers. When we are denied the right to be contracted and offer services under SHA, it means more than 6 million Kenyans are unable to access health services. And that, by extension, means we cannot achieve UHC. It means that when you want to conduct a procedure, you must seek permission prior from SHA. Under NHIF, we had been doing this pre-authorization. The cataract surgeons were able to do their cataract surgeries, anesthetists were able to do their services in the theaters. But about 3 weeks ago, they also removed this. And now they can no longer pre-authorize. We have so many patients waiting for cataract surgeries that cannot be done because 90% are done by clinic officers. We have so many patients who are unable to get surgeries because the anesthetists cannot be able to pre-authorize. We want to ask the President, especially the chair of the Social Health Authority, Dr. Abdi, who has shown to be very partisan and who cannot be able to differentiate between his cadre and cadre politics and ensuring that we achieve the universal health coverage. We want to ask the President to sack him and to sack those people in SHA that are extending this exclusion and discrimination and that are stopping the government of William Samoei Ruto from being able to ensure that they roll out UHC. The union, our advisory council sat yesterday and directed us that if in the next 3 weeks this discrimination and exclusion under SHA is not going to be resolved, on 23rd of December, clinic officers, all of us, shall be downing our tools. Because if they feel that they do not need our services, we can allow them to work with the people they feel that they should be able to work with. And I want to ask the President that we as Kenyans, we heard you when you told us that you wanted a social health insurance to ensure that we are able to, for the first time, have success of UHC. We believed you. But the people that you have put in place under the SHA board to be able to implement the same are letting you down. Because the President said that we are leaving no Kenyan behind. But what we are seeing coming from the board is exclusion of clinic officers, exclusion from contracting the facilities owned by clinic officers and registered by the Clinic Officers Council. And each and every other Monday, we shall be on the streets demonstrating, and we shall ensure that those people who are hindering the rollout of universal health coverage through SHA by taking their selfish interests to Social Health Authority are removed from Social Health Authority, because Social Health Authority is a social health insurance, and it's meant to ensure that every Kenyan, wherever they are able to access services. We have engaged the chair, we have engaged all of them, and they seem to be very partisan. We will continue calling for their sacking if they cannot be able to remedy the situation and ensure that Kenyans benefit from the money they are contributing and from the social health insurance that was put in place to ensure that they can be able to access these services. This crisis has come with the rollout of SHA. Under NHIF, our facilities were contracted. There was no problem. They were seeing patients under NHIF. But when SHA came in, they decided they can only take the licenses from KMPDC. But the law actually says the SHA law directs them to take licenses from all relevant regulatory bodies, especially provided by the Act of Parliament. In fact, we have more money under SHA than we had in NHIF. But the problem we are having is how this money is distributed. The funding model has a problem, because when you come to the primary health care, the funding is coming from the exchequer, from Parliament, and you know that there are limited resources there. The money Kenyans are contributing, you can only access it from level 4 going up. So it means that money is not accessible for you when you go to a health center or a dispensary where you are told 100% of Kenyans must be. And that is why we are also calling for amendment of the law to allow for the money that Kenyans are contributing to be utilized right from the dispensary, so that then this issue we are seeing of capitation of 900 that is lower than NHIF can end. That the problem we are seeing with NHIF is a corruption problem. There is a connivance between the SHA board and the KMPDC to force all the facilities, even those registered by the other regulatory bodies, to pay monies to KMPDC for monetary gain. And that cannot be anything other than corruption.
It pains us so much to find that our work is now limited because of the exclusion criteria they are using in the SHA. During the NHIF era, we used to do pre-authorization and surgeries for our patients. We do 80% of eye surgeries in Kenya. And you can imagine now that 80% of the workforce does not do the pre-authorizations. Now, as we speak now, many of our patients have not had surgeries done because we cannot do the pre-authorization for us to get services done. 90% of all eye services in the country is offered by a clinical officer, and that one cannot be changed. So what we need to do is that the SHA system, the authority in the SHA should take note that we should not let division within our unions make us not work for our patients.
Cannot be able to do the pre-authorization for the clients that we attend to. More than 90% of anesthesia services in Kenya is offered by clinical officer anesthetists. And that means this is a very important or a large chunk of the service providers who have been excluded from directly being able to authorize for the particular services that we normally give. It is very important that the government relooks into this so that we can be able to do that directly and offer the services that we have been giving. Remember,
the decision by SHA or Shisha, the way they call it, to remove clinical officers from whatever they're doing that you can't see patients is uncalled for. Just look at scenario. Kenya has only 5 dermatologists, though that's from KMPDC. But then we have 150 dermatology clinical officers, meaning all those cases of dermatology are seen by clinical officers. So if you decide to remove us from there, then what are you trying to say? Will the 5 dermatologists see all the millions of cases in Kenya? It cannot work.